The female version of Viagra is finally going to be hitting store shelves. So what do you need to know about the drug known as Addyi? Dr. Angela DeRosa is here, and we're talking to her about it next.
In Health Watch yesterday, the FDA approved they're calling it the female Viagra.
Right. The pill is called Addyi and is said to be the world's first pill to boost a woman's sex drive.
So, Dr. Angela DeRosa, owner of DeRosa Medical and expert on hormone replacement therapy, joins us. Thanks for being here.
Thank you for having me.
Is this a good thing or a bad thing, do you think?
In my opinion, I think this women just got sold a bill of goods. And this is a dangerous drug to treat a disorder that could be treated with hormone treatment, such as testosterone.
Do you think it's because of the long list of side effects is why it's so bad, or is it just a mix of problems that are associated with it?
Well, I think it's a mix of problems. The FDA, at least they finally got it right. They're paying attention to female sexual dysfunction, or in this case particularly hypoactive sexual desire disorder, but they got the right race, the wrong horse. And unfortunately, this drug is basically an antidepressant. So once again, women are giving antidepressants to treat a myriad of symptoms that are related to hormone deficiencies. If we could just give patients testosterone or estrogen in the appropriate cases, their libido would come up naturally without having to put them on an antidepressant. But this drug in particular is getting a black box warning, which is the worst kind of warning that can be labeled on a drug, because it causes syncope or passing out, which could be problematic if you're driving, severe sedation, dizziness, and they're actually requiring physicians to undergo special training, pharmacists to undergo special training to ensure that their patients are not taking alcohol, and frankly, forget about drinking and driving, don't take this pill and drink. Well, that's what has people get sexy anyway.
This is a totally different mechanism than Viagra, and they're calling it the female Viagra. But Viagra has to do with blood circulation, and this, you said, is an antidepressant.
Correct. And when you look at the differences between men and women, when men have erectile dysfunction, it's either due to low testosterone or blood flow issues in the penis.
Right.
Women, typically, when they have low sex drive, it's due to serotonin and other neuroreceptors or chemicals in the brain. So they tried to fix it with an antidepressant, but testosterone can do that naturally, and the FDA in 2004 rejected testosterone as a treatment for women, even though it had a very clean side effect. But now they're giving us a drug that is basically an antidepressant, which had very little improvement in the subjects, that has major side effects, that has issued a black box warning for patients. And you cannot drink, you shouldn't be on birth control pills and other medications, which most women drink or are on birth control pills or take antibiotics.
And I think you bring up a good point, like women that may be going through something where they have a low libido, it's not necessarily an age thing. I mean, they can be young and still going through this, so yeah, they could still be on birth control and still be, you know, preventing pregnancy and things like that. So,
and the drug's approved for premenopausal women, not postmenopausal women, so it's approved only for young women. So this has got a host of problems.
So older women wouldn't even be a candidate for this.
So this would affect maybe just a very small percentage of women in America.
Absolutely. And frankly, as a physician, I would be very, very cautious in recommending this to a patient. Frankly, I won't prescribe this drug.
I was going to ask you that, because of all the restrictions on this, so that wouldn't that cause physicians to just shy away from it and not prescribe it?
They absolutely should, because frankly, I've been specializing in women's health care for 25 years, and I advocate for drugs to treat sexual dysfunction. They've just got the wrong drug. And give us another antidepressant loaded with major side effects is a huge problem. We thought this was a win for women. We got sold a bill of goods.
So your practice is involved in hormonal therapy, and testosterone can correct the low libido for men and women?
For men and women. And actually,
the side effects of testosterone are?
If done properly, very minimal side effects. Occasionally women will get a little bit of extra hair growth on the face, but frankly, I'd rather take the $1 million house and mow my lawn every month.
That's a good way to look at it.
Versus actually, and when you look at the side effect profile, it's very minimal. And unfortunately, the data that they suggested in 2004 to shut testosterone down never came to play.
So what about the testosterone for men? Now, you prescribe that too, don't you? And what about the side effects there?
Same thing. I mean, typically with men, they don't mind facial hair.
No, that's
they're used to it. And the dose is much, much higher for men than it is for women, because they make more testosterone. But when done properly, it's very safe. And unfortunately, unfortunately, we're giving Band-Aids to symptoms.
Do you have
when we
any
don't
extra
need to.
testosterone pills on you right now?
Let me see. I'm going to my little bag.
Oh, very informative.
Yes.
Thank you. Okay, and the name of your practice, once again, is DeRosa Medical. And where are you located?
We're located in 5 locations across the valley.
okay.
Chandler, Gilbert, Scottsdale, Sedona.
A little bit
and
everywhere.
Everywhere.
Doctor, thank you. Great
Really
meeting you. Very,
appreciate it.
very
Nice to see you.
informative.
Andrea,
Thank
thank
you.
you.